In this presentation, we are going to revise all the spotting of the head and neck. First, we will start with the skull. This is the coronal suture. This is the sagittal suture, the lambdoid suture, the frontal bone, the parietal bone, the supraorbital notch, the infraorbital notch, the mental foramen. This is the maxilla, the nasal bone, the lacrimal bone, the zygomatic bone, the mandible or the symphysis mentae. This is the temporal fossa, the zygomatic arch, the mastoid process, the external auditory meatus, the styloid process, the tympanic plate, the mandibular fossa for the head of mandible, the zygomatico-temporal foramen. This is the greater wing of sphenoid, the pterion, the squamous part of temporal bone, the pterygomaxillary fissure leading to the pterygopalatine fossa. This is the lambdoid suture, the external occipital protuberance, and the superior nuchal line. In the cranial cavity, this is the crista galli, the cribriform plate of ethmoid, the orbital plate of frontal bone, the lesser wing of sphenoid, the anterior clinoid process, the optic foramen or optic canal, the superior orbital fissure, the foramen rotundum, the foramen ovale, and the foramen spinosum. This is the groove for the middle meningeal artery beginning from the foramen spinosum, and this is the foramen lacerum. This is the chiasmatic sulcus, the pituitary fossa or hypophyseal fossa, the dorsum celli, and the posterior clinoid process. This is the clivus, the foramen magnum, the internal occipital crest, the right transverse sulcus, and the left transverse sulcus. This is the jugular foramen. Above it is the internal auditory meatus, and below it is the hypoglossal canal. This is the hard palate. This is the palatine process of maxilla, horizontal plate of palatine bone, the incisive canal, the greater palatine foramen, the lesser palatine foramen, and this is the pterygoid hamulus. This is the vomer, the medial pterygoid plate, and the lateral pterygoid plate. Regarding the foramina, this is the foramen ovale, foramen spinosum, behind it is the spine of sphenoid. This is the petrous bone containing the carotid foramen or carotid canal. This is the jugular foramen. This is the foramen lacerum, and this is the stylomastoid foramen. This is the foramen magnum, the basilar part of occipital bone, and one of the occipital condyles. Regarding the mandible, this is the body, the ramus, the angle, the head, the neck, the coronoid process, the mental foramen. From the inside, this is the mylohyoid line, the mental spine made of 4 genial tubercles, the mandibular foramen leading to the mandibular canal, the lingula, the sublingual fossa, the mylohyoid groove. Regarding the atlas, this is the lower surface because the articular facets are circular and flat. This is the anterior arch and anterior tubercle. This is the posterior arch and posterior tubercle. This is the foramen transversarium in the transverse process. Regarding the axis, this is the dens or odontoid process. This is the articular surface for the lateral mass of atlas. This is the anterior tubercle of the transverse process, the posterior tubercle of the transverse process, and the spine. Regarding the hyoid bone, this is the body in the middle, the greater horn, and the lesser horn. Regarding the thyroid cartilage, this is the oblique line on the thyroid lamina. This is the superior horn, and this is the inferior horn. From the 5 layers of the scalp, this is the skin, the subcutaneous fatty connective tissue, the epicranial aponeurosis, and the periosteum of the skull or pericranium. Regards the facial muscles, this is the frontalis, the orbital part of orbicularis oculi, the palpebral part of orbicularis oculi, the buccinator, and the platysma. This is the parotid duct, the parotid gland, the cervical branch of facial nerve going to supply the platysma, the marginal mandibular branch, the lower buccal branch below the parotid duct, the zygomatic branch going to the zygoma, and the temporal branches. This is the facial vein and the facial artery anterior to it. This is the supratrochlear nerve, the infratrochlear nerve. This is the supraorbital nerve and vessels, the palpebral branch of lacrimal nerve. This is the infraorbital nerve and the mental nerve. This is the buccal branch of mandibular nerve. This is the temporal fascia, the temporalis muscle, the masseter muscle, receiving the masseteric nerve which passes through the mandibular notch. It is a branch of the mandibular nerve. After removal of the ramus of the mandible, in the infratemporal fossa we can see the lateral pterygoid, the medial pterygoid below it. This is the buccal branch of mandibular nerve. This is the lingual nerve emerging at the lower border of lateral pterygoid, the inferior alveolar nerve and artery behind it, and this is mylohyoid nerve. This is the maxillary artery, and this is the auriculotemporal nerve arising from the posterior division of mandibular nerve by two roots which surround the middle meningeal artery. This is the chorda tympani nerve joining the posterior aspect of the lingual nerve. The last two structures are seen only when the lateral pterygoid is removed. In the cranial cavity, this is the dura mater. This is the arachnoid and pia mater covering the surface of the brain. This is the falx cerebri, the tentorium cerebelli, and the falx cerebelli. This is the middle meningeal artery above the dura. Regarding the dural sinuses, this is the superior sagittal sinus, the inferior sagittal sinus, the great cerebral vein, the straight sinus, the left transverse sinus, the left superior petrosal sinus. Again, on the intact dura, we can see the superior sagittal sinus, the left transverse sinus, the confluence of sinuses, and the occipital sinus. This is the site of entry of the first cranial nerve. It is the olfactory bulb, giving the olfactory tract. This is the second cranial nerve, or the optic nerve. This is the internal carotid artery emerging from the cavernous sinus. This is the third cranial nerve, or oculomotor nerve, piercing the dura in front of the point of crossing of the two margins of tentorium cerebelli. This is the fourth cranial nerve, or the trochlear nerve, piercing the dura exactly at the point of crossing. And this is the fifth cranial nerve, or trigeminal nerve, entering the cavum trigeminal just behind the point of crossing. This is the sixth cranial nerve, or the abducent, piercing the dura opposite the clivus of skull. These are the seventh and eighth cranial nerves, or the facial and vestibulocochlear, entering the internal auditory meatus. These are the 9th, 10th, and 11th cranial nerves, or the glossopharyngeal, vagus, and accessory, all of them entering the middle compartment of the jugular foramen. This is the spinal root of accessory nerve, entering through the foramen magnum to join the cranial part. This is the left vertebral artery. This is the basilar artery made by union of the two vertebral arteries. And this is the hypoglossal nerve exiting through the hypoglossal or anterior condylar canal. This is the trigeminal ganglion, giving the ophthalmic nerve, the maxillary nerve, and the mandibular nerve. This is the abducent nerve running in the floor of the cavernous sinus. Regarding the bony orbit, this is the optic foramen or optic canal, the superior orbital fissure, the inferior orbital fissure, the supraorbital notch or foramen, the lacrimal groove, the posterior lacrimal crest, and the nasolacrimal canal. This is the infraorbital groove, which continues into the infraorbital canal that opens on the face by the infraorbital foramen. This is the anterior ethmoidal foramen and the posterior ethmoidal foramen. Regarding the dissected orbit, this is the optic nerve. This is the superior oblique muscle receiving the trochlear nerve. This is the frontal branch of ophthalmic nerve, dividing into supratrochlear and supraorbital. This is the levator palpebri superioris, covering the superior rectus, and this is the lacrimal nerve going to the lacrimal gland. This is the internal carotid artery, giving the ophthalmic artery that runs under the optic nerve. It then crosses above the optic nerve from lateral to medial, accompanied by the nasociliary nerve. These are the roots to the ciliary ganglion. This is the ciliary ganglion. These are the short ciliary nerves. This is the abducent nerve going to supply the lateral rectus. This is the superior oblique muscle, and this is the trochlear nerve that supplies it. Under cover of the superior oblique, this is the medial rectus. This is the optic nerve, and this is the inferior rectus. From the front, this is the lacrimal gland. After removal of the eyeball, the extraocular muscles can be seen. This is the levator palpebrae superioris, the superior rectus, the inferior rectus, the medial rectus, the lateral rectus, the inferior oblique, and the superior oblique. Regarding the auricle of the external ear, this is the helix, the antihelix, the tragus, the antitragus, the lobule, and the external auditory meatus. Regarding the neck, superficially we can see the platysma. When it is removed, we can see the sternomastoid. This is the external jugular vein. This is the trapezius. These are the four cutaneous branches of the cervical plexus, emerging from the midpoint of the posterior border of sternomastoid. The first one is the great auricular nerve. This is the second one, which is the lesser occipital nerve. This is the transverse cervical, the medial one of the supraclavicular nerves, the intermediate one, and the lateral one. In the posterior triangle, we can see the inferior belly of omohyoid. This is its superior belly. This is the scalenus anterior, scalenus medius, scalenus posterior, levator scapulae with the spinal accessory nerve running on it, and splenius capitis. This is the third part of subclavian artery. These are two of the branches of the thyrocervical trunk. The lower one is the suprascapular, and the upper one is the transverse cervical. This is the phrenic nerve descending on the scalenus anterior. This is the platysma muscle, the external jugular vein, the common facial vein, the sternomastoid, superior belly of omohyoid, sternohyoid, sternothyroid, and thyrohyoid. This is the thyroid cartilage, connected to the hyoid bone above by the thyrohyoid membrane. This is the cricoid cartilage and the two cricothyroid muscles. This is the first ring of the trachea, the isthmus of thyroid gland covering the second and third rings, and the two lobes of the thyroid gland. This is the spinal accessory nerve, the common facial vein ending in the internal jugular vein. This is the hypoglossal nerve making a forward loop and giving the descending limb of the ansa cervicalis in front of the carotid sheath. This is the vagus nerve in the carotid sheath. This is the submandibular gland. This is the internal laryngeal nerve going to pierce the thyroid membrane. And this is the external laryngeal nerve going to supply the cricothyroid. Behind the carotid sheath, this is the sympathetic chain. This is the common carotid artery, giving external carotid anteriorly and internal carotid posteriorly. This is the first branch of external carotid, which is the superior thyroid artery. This is the second branch, or the lingual artery, which makes a loop deep to the hypoglossal nerve. This is the ascending pharyngeal branch. This is the occipital branch. This is the posterior belly of digastric, its anterior belly, and its intermediate tendon. This is the mylohyoid muscle, the hyoid bone, the anterior belly of digastric, and the mylohyoid raphe. In the deep dissection of the neck, this is the scalenus anterior, scalenus medius, phrenic nerve descending on the scalenus anterior, trunks of brachial plexus emerging between the scalenus anterior and medius. This is the upper trunk, the middle trunk, and the lower trunk. This is the third part of subclavian artery. This is the subclavian vein running in front of the scalenus anterior. The subclavian artery gives many branches from the first part. This is the vertebral artery. This is the thyrocervical trunk, giving the inferior thyroid artery. In this specimen, it also gives the ascending cervical artery, which typically arises from the inferior thyroid artery. This is the transverse cervical artery, and this is the suprascapular artery below. This is the recurrent laryngeal nerve in the groove between the trachea and esophagus. This is the superior ganglion of the sympathetic chain, the longus capitis muscle, and the longus colli muscle. On the back of the neck, the first layer is made by the trapezius, the second layer by the splenius capitis. Both splenius muscles make something like the letter V. In the third layer, there are two longitudinal muscles. The medial is semispinalis capitis, and the lateral is longissimus capitis. In the fourth layer, we have the suboccipital triangle. From the triangle, the dorsal ramus of the first cervical nerve or suboccipital nerve emerges. Below the triangle, the dorsal ramus of the second cervical nerve or the greater occipital nerve arises. And this is the dorsal ramus of C3 or the third occipital nerve. This is the rectus capitis posterior major. This is the inferior oblique. This is the superior oblique. This is the rectus capitis posterior minor. And this is the semispinalis cervicis going to the spine of axis. In the sagittal section of the head and neck, we can see the hard palate separating the nose from the mouth. Behind it is the soft palate separating the nasopharynx from the oropharynx. This is the epiglottis that separates the oropharynx from the laryngopharynx. This is the posterior nasal aperture or choana. This is the opening of the auditory tube or eustachian tube. Above it is the tubal elevation. And this is the salpingopharyngeal fold. Between the mouth and oropharynx, this is the palatopharyngeal fold, and this is the palatoglossal fold in front of it, and this is the tonsillar fossa in between. This is the median glossoepiglottic fold between the tongue and the epiglottis, and this is the left vallecula. In the laryngopharynx, this is the pyriform fossa, and in the larynx, this is the lamina of cricoid cartilage, the arytenoid cartilage, the aryepiglottic fold between the arytenoid and the epiglottis. This is the vestibular fold and the vocal fold below it. Between them is the sinus of the larynx. This is the vestibule or the supraglottic portion of the larynx and the infraglottic portion. Regarding the nose, the anterior part of the septum is made by the septal cartilage. Posteriorly, this is the vomer bone. This is the vestibule or entrance of the nasal cavity. It is lined by hairy skin. Above it is the atrium of the middle meatus. On the lateral wall, there are three conchae. This is the inferior one. This is the middle concha and the superior concha. When the middle concha is removed, we can see the bulla ethmoidalis made by the middle ethmoidal sinus. Below it is the hiatus semilunaris, where the maxillary sinus opens. And this is the infundibulum, which receives the openings of the frontal air sinus and the anterior ethmoidal. This is the superior meatus, where the posterior ethmoidal sinus opens. And this is the sphenoethmoidal recess receiving the opening of the sphenoidal air sinus. This is the genioglossus muscle. Below it is the geniohyoid muscle, and below it is the mylohyoid muscle. This is the end of the revision. Thank you very much. I advise you to repeat it again with the sound turned off.